When trying to beat cancer, it's important to be effective. So today we have Gail Sarto with us, and she is the Director of Adult Nursing at UF Health Proton Therapy Institute. Welcome to the show, Gail.
Thank you, and thank you for wanting to talk about the role of nursing here.
Absolutely. It's very important, very valid. So I think you're the perfect person to actually answer this, though. I want you to explain the role that a case manager plays here at UF Health.
Well, we think it's very important that patients understand that we know what their journey's been before they even arrive here. So our nurses start even before the patient arrives, helping gather any of the information that the providers need in order to have a comprehensive first-time visit with the doctor. So initially they come in, we're the first member of the care team that they see, and it's important that we're present for their questions and make them feel welcome. Also make them understand that we know who they are and where they've been. And once they're on treatment, we follow them minimally at least once a week. And at times we have to see patients daily to provide physical and emotional support. And then in survivorship, my nurses have a phone on their desk. So if you call and you have a question, you're going to get your nurse. And I think that's really important to patients because they feel like they're personally cared for. Some of our patients we've been following for 10 years, and that's unique to a radiation oncology setting because many times after you're treated, you see your provider once or twice, and then you go on to survivorship in the community, which isn't a bad model, but isn't always the model that works for every patient.
So it sounds like, Gail, you're really a big advocate for the patient. Is that true?
It's important that patients have a voice, and patients come with different needs, not just their needs, but the needs of their family members that are with them, their grandparents, parents, children. So we try to find out what do these people need and how can we connect them with the community resources we have here in Jacksonville.
And you're really good with out-of-town patients, and also as an advocate, you're helping with billing and insurance questions. Is that true?
It is true. Many patients, you may be coming here for treatment, but you're from out of town, you have a dental need or a vision need, so we try to meet their needs, and also you may have a family member that's diabetic or needs some cardiac help, so we try to match their needs up with the community. And billing is a huge issue for patients. They are very overwhelmed, and we try very hard to work with their insurance companies to minimize the impact of that really tremendous burden of working through that system.
So true. Whenever you're trying to get through an illness, family, or yourself, that's really great to have an advocate on your side. Well, let's go into the nurse's role here, because I found it really interesting. You were telling me before about the research that you provide here. Talk to us about the research.
Well, it's an academic setting, and we do a lot of research because we are a state-of-the-art modality of treatment. So our patients can go on the internet now and look for publications, find out how do they want their cancer to be treated. So we work very hard to introduce research protocols to the patient, collect the data, and help the doctors publish these papers so patients can make informed, research-based decisions. And the clinical nurse is also the nurse that will be that research nurse, which is a unique model. So.
Well, what would you like people to know if you're just talking about the nursing philosophy here?
I think it's really important that all of our nurses, and they do understand it's a privilege to be part of this journey for a patient. It's a life-changing event, and we are present for the patients. It's very important that they know that they can come to us with their concerns. We try to treat them holistically. They're not just a diagnosis, they're many things. And we want to be present for all of those needs that they have. And also we know patients can go on the internet and get a lot of information. They're partners in care, and they own more of the partnership than we do because it's their life. So we want empowered patients. We want patients who ask questions. So, and we have a very diverse community. They come from all over the world, and even here in Jacksonville, many diverse understandings of their disease, their ethnic backgrounds, what they hope to get from their care providers. So it's important for us to honor and be present for that diversity as well.
Well, here at UF Health Proton Therapy Institute, it sounds like everything is all-encompassing from the beginning all the way through the process and even well after. I mean, up to 10 years after, it's so far just in clinical research. So
It is.
thank you so much for your time. We
Yes.
appreciate you.
Yes, thank you.
And thank you to UF Health Proton Therapy Institute for sponsoring this segment. And for more information, you can visit floridaproton.org or call 904-588-1436.